can't take it anymore. This project, it's too much. Ah, who am I kidding? I can't do it. Deanna. I want you to shoot me.
Are you sure? You're positive. Alright. I'm Deanna Lane.
And I'm Jacob Hurley. This is our Theory of Knowledge presentation on the considerations of assisted suicide.
Assisted suicide, in the most basic form, is the act of receiving or giving aid to a person seeking death.
Generally illegal, with varying amounts of morality and ethical considerations, which will be discussed later on, assisted suicide is a broad and touchy subject containing many uncertainties.
Unless otherwise specified, we will assume the standpoint that the subject wants to die and those aiding the subject have the best intentions. To best understand this, we should understand why people want to die in terms of ending their life early. A 1990 Dutch study conducted some research on those seeking legal death.
Those seeking to hasten their death attributed it to their imminent death from terminal cancer, AIDS, and multiple sclerosis.
In these cases, treatment would only prolong their life, but the treatment meant pain and suffering through chemotherapy and other options.
The terminally ill patients reasoned their suicidal needs by not wanting to suffer, not wanting to be a burden, not wanting to spend their final moments in a hospital, or wanting to be alert and keep their wits, or wanting to know when they will die, and also wanting a dignified death.
This draws major criticism from those opposed to assisted suicide. The opponents of this movement say that people who want to die are not properly cared for. This includes pain and depression. This draws major criticism from those opposed to assisted suicide. The opponents of this movement say that people who want to die are not properly cared for. This includes pain and depression. One can reason that those that are ill are in more pain than is acceptable and are suicidal because of that fact.
The other argument is that they are getting, in fact, the correct treatment and they still want to die for reasons stated previously.
This is, however, in the eye of the beholder and touches bases with the emotional way of knowing as well as the area of human sciences. Depression, as defined by WebMD, is a serious mood disorder consisting of a, quote, sad feeling lasting longer than a week.
This sadness comes with other physical symptoms like weight gain or loss in interest in normally pleasing activities, and some people even exhibit aggression and anger in addition to these other symptoms.
This is a largely psychological problem and is not completely understood.
This misunderstanding might explain why only 60% of participants in a Dutch study showed positive results when placed on antidepressants.
In comparison, 40% of a different tested population showed improvement out of placebo pills.
If these numbers hold accurate to the general population of Holland, approximately 40% go on being depressed, or approximately 2 million people in Holland alone.
These 2 million who are taking an ineffective drug are a large part of the body that asks for assistance in killing themselves.
Another reason people seek assistance in suicide is because of their pain and suffering.
Pain is a relativistic term and is subjective and is different from person to person.
This would mean that everyone would respond differently to pain medication and have different tolerances.
This can then lead to mismedication, and just like depression can also lead to seeking death.
Pain, as a constant fact of life, is typically something that people will put up with unless the intensity is high enough.
We can take another example from Eric Marcus. He mentioned a mortally wounded soldier. Knowing that there was no other hope for recovery, asked a fellow soldier to assist him, knowing doctors would only prolong his suffering. The only other information given was that his friend did agree to end his suffering.
This sends up red flags of ethical considerations.
Did the wounded soldier really want to die?
Was this a murder?
If this case went to trial, there would only be one witness to testify, and he could make up all the stories he wanted.
This is another major point for those in opposition of the lawful suicide.
Of all the situations that it could occur, this example draws the line to many people. My personal standpoint is that this is an act that should be legal. I believe that if a patient is suffering, he or she should be allowed to choose death as a possibility. I don't believe that doctors, or anyone for that matter, should be allowed to tell a suffering individual that they must keep suffering and await a fractional possibility of becoming better or healing. We may not know a whole lot about death, but who are we to say that one must stay alive? I believe that if life is an option, death too should be one as well. It is a very heated argument, but I'm willing to say that if one desires to die in any situation, why stop them? I understand depression, being a mind-altering disorder, is often a factor, meaning that there must be some form of limitations or boundaries, in comparison to my rather broad view. I personally feel that if limitations must be set, then the person seeking a way out should be terminally ill or advancing the final stages of the illness, leaving little to no possibility of survival. After this point, the person's life is often stripped of all happiness and joy, and they are incapable of enjoying themselves furthermore. Also add this to the money and cost of maintenance, the burden, and the overwhelming grief on the loved one's part. I believe they should be allowed to end the unnecessary constant struggle of holding on to life unwillingly.
One of the biggest proponents of assisted suicide was Dr. Death, aka Jack Kevorkian.
Dr. Death aided in the suicides of more than 130 people in 8 years.
However, he was arrested only once for his actions. In the case that sent him to prison, Kevorkian himself administered the lethal potassium chloride mixed with a potent sedative.
Potassium chloride overdose will cause a heavy feeling in the limbs, confusion, slowing or irregular heartbeats, and possibly seizures.
All of these would have occurred while the patients were sedated, so the likelihood of pain was minimal, if not non-existent.
To put this in perspective, lethal injection is said to be painful and felt in 90% of recipients. This was determined by post-mortem studies and is legal in 33 states.
Anyway, the Los Angeles Times posted an article about a year ago on Kevorkian, bringing up some old interviews and information.
In this article, Kevorkian goes through his procedures of assisted suicide with his first client, Janet Adkins.
Janet was in the early stages of Alzheimer's and was determined that the disease would not progress and send her into an unknowing oblivion.
Kevorkian connected Adkins to his Mercitron and a heart rate monitor, and while Kevorkian's sister comforted her, she pressed a button on Kevorkian's suicide machine and fell unconscious as part of the suicide mixed with sedative, and reportedly died peacefully and quietly as the potassium chloride stopped her heart.
Afterward, in a publicized interview, he was quoted for the local TV.
It's not a matter of how long you live, but the quality of the life you live, and it was her life and her decision, and she chose the way to go.
It is very important to note that Michigan law in the 1990s did not forbid suicide or assistance thereof.
Kevorkian did eventually lose his medical license because of his practices, and with that, access to potassium chloride.
That didn't stop Jack, though. Soon after, he adopted a face mask and to output carbon monoxide, which when inhaled simply puts people to sleep, similar to a sedative, when they were unaware that they were actually choking.
Then things started to go downhill. In 1994, assisted suicide became a criminal offense, as determined by state law. This was almost directly and explicitly to getting Kevorkian, and following up was a sentence guideline published in 1998.
During those years, Kevorkian was charged 4 times and convicted 0 times, but in 1998 he was finally convicted after personally administering the drugs.
His trial in 1998 got him sentenced 10 to 25 years.
8 years later, however, he was released on parole with the condition of no more aiding suicide.
3 years later, he was depicted in the Al Pacino movie, You Don't Know Jack.
Pacino said before the premiere, refuting some rumors, Jack turned away the vast majority of people that came to him. He didn't take money for what he did, and he didn't see his patients as people that he was killing. He saw them as people whose pain he could relieve.
As long as we're in the past, let's keep going.
Euthanasia comes from the Greek word euthanos, meaning easy death.
The Greeks had their own morals similar to today's, in the sense that they want to alleviate suffering. But we're not as concerned with the legal realm as we are today.
The Greek view on death was to leave the world with peace of mind and in minimum pain.
They did not contain the typical negative connotations of today either.
They viewed suicide as a legitimate way of dying.
The Christians had a very different view on dying.
Their ideology in this subject states that God is the only one that can take life, and that assisting one in death is blasphemous, and they are taking the place of God.
This was slightly adapted with advancements in technology in the 19th and 20th centuries, as religious beliefs were questioned and disproven, and science was reigning supreme.
This period of medical expansion came with promises of a longer life, and one filled with less pain and suffering.
It is possible that the family may not approve of the person's choice. With my brother's death recently, I understand the emotional toll that grief can take from that point. I believe this is really tricky. Evaluations and exams should be followed through thoroughly. The people want to end their life. They perceive their life to be, for the majority, already over. They desire to hasten their death, and I believe we should allow them to do so. Though it is ultimately the person's life, it is their choice whether they enjoy it or not. We do not know what's after life, so we should allow them to find out one way or another.